And we really are going to make a point, and Dr. Chokshi will lead the way, of keeping the public informed with each and every new development. But what we are saying clear as a bell today is what has worked up to now continues to be the key: vaccination, and obviously masks play a very important role as well. Dr. Chokshi.
Thank you so much, Mr. Mayor. As you said, there are currently no confirmed cases of the Omicron variant in New York City or in the United States. Delta remains the dominant strain in NYC, with about 98% of specimens sequenced being the Delta variant. New York City has one of the strongest variant surveillance systems in the country, sequencing hundreds of cases a week. And we do anticipate detecting Omicron in New York in the coming days based on what we know about its global spread. A lot is still unknown about Omicron because it's so early, but studies are underway and we will know more about the variant in the coming weeks. We should all give our thanks to the scientists and researchers in South Africa for their speed in discovering the variant, as well as their transparency. Allow me to break down what is currently known now in terms of transmissibility, severity, and immunity. First, transmissibility. We don't have reliable evidence yet about Omicron's speed of spread compared to Delta, but it does have similar mutations to other transmissible variants, and there are some reports from South Africa indicating potentially rapid spread. Second, severity. We have even less evidence about whether Omicron contributes to more severe or, as is possible, less severe disease. You may have heard some reports of milder illness in South Africa, but take them with a grain of salt. Rigorous investigations are still underway since hospitalizations and deaths lag cases. We do know that some of the treatments for COVID-19 disease, including new oral antivirals anticipated to be available soon, are still likely to work. Third, immunity. This is perhaps the most important scientific question as to whether Omicron pierces immunity from vaccination or from prior infection. Preliminary evidence suggests that those who've had COVID-19 in the past may be more easily reinfected with Omicron. This underscores our strong recommendation to get vaccinated, regardless of whether you have already had COVID-19. The World Health Organization and vaccine manufacturers are working to further understand how the vaccines hold up against Omicron. Based on what we have seen with other variants, we do expect the vaccines to retain some degree of effectiveness, but precisely how much will take a few weeks to clarify. But remember that the vaccines are proven to be effective against Delta in the here and now. And for the most recent week of data, unvaccinated New Yorkers were nearly 7 times more likely to be infected than vaccinated residents. To summarize, we still have a lot to learn about the Omicron variant, but its emergence lends urgency to the importance of the precautions we've all become familiar with, particularly vaccination, masking, and testing. For vaccination, as you heard from both the mayor and the mayor-elect, get your first dose, second dose, or booster today. And parents, please get your child vaccinated as soon as possible. Cases have been rising, including among our youngest New Yorkers in recent weeks. Today, as the mayor mentioned, I am also issuing a commissioner's advisory strongly recommending that all New Yorkers wear a mask at all times when indoors and in a public setting, like at your grocery or in building lobbies, offices, and retail stores. This includes those that are vaccinated and those who've had COVID-19. Higher quality masks like KN95s or KF94s can offer an additional layer of protection. And masks are still required for everyone in public transit, healthcare settings, schools, and congregate settings. Finally, testing. Coming out of the holiday weekend, it's very important that those who traveled or gathered get tested if you haven't already. With our colleagues at Test and Trace, we'll be working to make rapid testing even more readily available in the communities that need it most. To wrap up, Mr. Mayor, it's natural to feel some anxiety about the new variant, and I'm certainly feeling humility given all that we've been through. But the Marie Curie quote, "Nothing in life is to be feared, it is only to be understood," comes to mind. Our understanding of Omicron will advance and we'll be able to adjust our public health strategies accordingly. Until then, let's bring to bear our tried and true tools that are already helping us keep COVID-19 at bay. Thank you, sir.
Thank you very, very much, Commissioner. Thank you, as always, for your leadership. And everyone, as we move forward in this fight against COVID, I'm going to use the phrase I've used many times before. We are going to be climbing the ladder. We're going to be using a variety of tools and continuing to focus on the tools that allow us to get people vaccinated and stop COVID. You heard from the Commissioner. Our information to date is that any of the variants we've seen are affected helpfully by the vaccine. The vaccine works against every variant we've seen up to now, and we are working with that assumption again. So we need to keep doubling down on vaccination. And this city has been leading the way, leading the nation in vaccination. It's something New Yorkers should be proud of, but we got more work to do now.